Hi guys, so this is Daniel still here, and I want to quickly, like using less than 10 minutes, to take you through how to prepare for your objectives and practical licensure examination. So I hope you guys are all doing great. Yes, and I hope you are studying for your licensing exams, the NMC. And let's quickly dive straight into it, and let's start with the objectives. Okay, so the objectives will be very brief, because you wouldn't be doing anything that much. Yeah. So with the objectives, what you do is pray before the exams. You have to be praying. Yeah, you pray before the exams. You even pray after the exams so that everything goes on well. Yes, because it's a computer, and there can be internet faults. There can be something can go on, and yes, you'll be in trouble. So you just pray. And the last step is to solve past questions. Yes, solve past questions. You've been in the school for 3 years now. It's not now that you're coming to learn a new thing. Yes, I don't know, when it gets to those times, I see a lot of people now going and reading and reading and reading. What haven't you read for these 3 or even 4 years if you are doing a degree? Yes, you've already done those things, so don't stress. Just solve past questions. And when you're solving past questions, do make sure that there is a nurse and there is a midwife. Yes, there's a nurse and there's a midwife, because some midwifery students tend to get some questions. Yes, you get some questions from some people, and maybe they are coming little. So you just make sure you blend a nurse, a midwife, then you study together. So it helps. Yes, they are only going to write the general paper, and sometimes their general paper, the questions that they get to study, the past code that they get to study before the general paper, you can see that when the general nurse goes to write, he or she will find some of these questions in either medical or surgical, which will be of great help to the general nursing student. Okay, now let's move to the practical. So you just pray as usual. You pray. Okay. During the practical exams, I'm sure by now you should have the NMC component tax. Yes, as a KNUST student. I'm saying this to KNUST student because mostly we have our KNUST component tax and we have the NMC. Yes, so we have been learning the KNUST ones for our internal exams. Yes, so by now you should get the NMC component tax and you should read through, even though there are some slight differences. Yes, it's similar. It's similar to the KNUST component tax, so you should get it by now and you should go through. Okay, what will happen in the practical examination is that before the exam starts, you go to the hospital or whatever unit you are assigned to, either medical or surgical. You'll be doing both, so which one you go first, and you familiarize yourself with the patients there. You ask the in charges their conditions and what will mostly be the questions or the tasks that you'll be given. Yes, so the likely tasks that you get from those conditions. So you ask the in charges, please respect the in charges, honor them, just revere them. Yes, don't go and show your pride there. No, do not be arrogant. Just go down, humble yourself, and talk to them. Okay, so after doing all these things, that's before the exams, the practical exams. So a day before that, you go home and you practice. Okay, you practice how to write the care plan for those conditions, and also you do some tasks that you see or you think that they are likely going to give to you. Yes. Now on the day of the exam, the practical exam, you go there on time. Yes, and you check whether those conditions are still there. So you go there very, very early. Yes, and since you were laughing with the in charges, they'll allow you to go, which is mostly against the NMC rule, because the student should be allowed into the hospital on the day of shouldn't be allowed before the exam starts. Yes, on the day of the practical exams. Yeah, so but if you are very cool with them, you can go and check if the patients are still there with the same condition, then you are good to go. Yes, and you'll be given you write four care plans, not I think you write 4 care plans. Yes, 2 medical, 2 surgical for the nurse. Yes, I think the midwives, I think it's 1 or so. Yeah, I didn't really ask them. So for the general nurse, you'll be writing 2 and 2 there. Okay, 2 medical, 2 surgical. Yes, and make sure you know how to write the care plan. If you haven't watched my video on care plans, you make sure you go back and watch those videos. It will be of great help to you. So you watch the care plan, how to write the care plan, and if you are very good with the care plan, you've solved half of your worries. Just as I've been saying, with the care plan, the other treatment at the back page, the other treatment where the investigations are and the medications, make sure you write at least one thing at other treatment. Maybe you said you give the patient diversional therapy. Write the diversional therapy there. Hope you get me. Yes, maybe physiotherapy. Write the physiotherapy there. Yes, I think I've talked about that extensively in my video about care plan, so I wouldn't go there. So after the care plan comes the real practical exam. So what will happen is that mostly the invigilators are being told to give you the practical exams in two forms. One should be done with hand or by hand, or practically, so you'll be doing things, you'll be touching the client or the patient, and the other should be verbalized. Yes, so mostly they do it in these two forms. So things like taking up, handing over, education on medication, education before discharge, education on conditions are things that you will say. So they'll give you one of such things that you say. And things like vital signs, IM injections, IV, giving medications, etc. All these two are things that you do by hand, and bed making, etc. So they'll give you one here, one there. I hope you get me. So that's how it will mostly be, but it depends on the invigilator, just as I said. Yes, it depends on the invigilator. So in my case, I had for the medical or surgical, I had bed making, yes, one of the beds, and also giving of IM injection. And for my second day, my second task, I had taking up, yes, taking up, and I think what's taking up and caring for the catheter. Yes, caring for the catheter. So these are the tasks that I had. Yes, and by God's grace I was able to do them. Yeah, so the preparation should be done in the right prior to the exam. So you prepare yourself very well with your care plan. You know that it's time bound, so you make sure you write it faster, and also with the practical. Yes, and sorry, and with the practical, do not go and challenge the invigilator. If the invigilator says this is how you should do it, you just nod your head and you thank him and you do it that way. Yes, don't go and challenge the invigilator. And if you can't do a task, this thing, you know that you've spent 3 years, 4 years, all the tasks you should be able to do them. But if you can't do a task, maybe you can plead with them. Yes, you can plead with them so that they change it for you. Yes, so I think this is what I can say about the licensing exams. Yes, so you pray, and you learn. Yes, you learn, and you make sure you are very cool with the nursing charges there. They can really be of help to you. Yes, so that you can pass easily. Yeah, and you make sure with your dressing too, it's very important to dress well. The guys, you shave your beard, and you trim your beard and you shave your hair well, and yes, before going. Else, even if they see your appearance, they will tend to give you difficult taxes. Yeah, so basically that is that. Yes, so I wish you all the best in your licensing exams, and I am Nurse Daniel. Right after the licensing exams, there are a lot of procedure you go through before you start your rotation, and I'll try and make a video about that, the payments that you need to make, yes, and the procedure that it entails. So until then, this has been Nurse Daniel, and bye bye.